All right, let's talk about antibiotics. I get a lot of people asking questions about antibiotics, and I especially get a lot of people who say, Doc, I've been sick, and the doctor put me on antibiotics. And I think a lot of people are kind of missing really what antibiotics are for, the upsides and the downsides, and I just kind of want to walk through um, what taking an antibiotic really means as far as your health is concerned, what it's accomplishing and what it's not accomplishing, and also what to do if you're sick in place of antibiotics or after you've already taken them, some of those kind of scenarios. So the reality is antibiotics were, when they were first kind of discovered or invented, they were really just a miracle drug. They were very effective and just seemed to essentially really turn things around as far as a lot of illness with the general population. And ever since then, they've become more and more widely adopted and commonly prescribed. Now, in fact, these days, it's really at a point where, unfortunately, they've become very much overprescribed. They are pretty much just thrown at anything and everything. In fact, what research shows is they're one of the most commonly misprescribed medications out there. And unfortunately, there's quite a bit of downside coming about because of that. One of the big problems that people don't realize is an antibiotic is to kill a bacterial infection, but rarely is anyone even tested to see if they actually have a bacterial infection. And so if it's a viral infection, for example, an antibiotic isn't going to do you any good. And one of the more problematic things that we're running into now is research is kind of finally catching up to the bigger picture with antibiotics, and we are realizing that this is a losing battle. That while we kind of won the war initially by utilizing antibiotics to fight off disease, what we've realized is there's just too many different types of infections out there for us to make an antibiotic for each. And the more that we make and the more that they are used, the more that infections and bacteria are adapting to become resistant to the antibiotics. So now we're getting superbugs. They're much more dangerous. They're much more resistant. We don't have good treatments for them, and we're literally creating them ourselves. And we could talk all day about that situation, but suffice to say that in the future, it's just not sustainable, and we really need to find a different way. Now, the good news is we already kind of know a more effective and natural, safe route. In fact, much more effective. And we can kind of talk a little bit about that. So a couple things to understand about what an antibiotic does. So it destroys microorganisms, bacteria in particular, but it is non-discriminatory. So when you take an antibiotic, it's killing everything that looks like, smells like, tastes like a bacteria, the good stuff along with the bad stuff. And so while that may help you out by not experiencing the downsides of the negatives, it's also going to eliminate your capacity to experience the good side of the healthy bacteria. And what are those doing for you? Well, for every cell in your body, you've got anywhere from 10 to 100. I've even heard research say up to 1,000 times as many bacteria in your body. So there's quite a few of them, and they're doing all sorts of things. One, they're a huge component of your immune system. They also are required to help you digest food and also assimilate certain vitamins. They even produce certain vitamins for you. So you can see how if you destroy these bacteria, there's a pretty big downside as far as a change in your digestive system, a decrease in your immune system, and also a lowered capacity to produce the raw materials necessary for health and life. So these are things we have to consider. Now, when unfortunately we take an antibiotic, like I said, it's kind of like just dropping an atom bomb on things. It is just going to kill everything. And so then what happens? Well, something is going to fill in the gap. Something's going to replace those. And so one of the big problems that people have, and what they're not educated on, is they'll just kind of get thrown on an antibiotic. They'll finish it up. Hopefully they'll feel better. If not, they get more antibiotics. But finally their symptoms kind of go away. They think everything's fine. they don't realize now that their immune system has been permanently damaged, that they are not functioning properly. They're acting at their body's functioning at a deficit, and they are more prone to another infection, another problem. And so we kind of start this downward spiral where we get sick once and then sick again and again, and the treatment, makes us more susceptible to the problem. And it's a downward spiral that a lot of people end up on. Some people end up taking antibiotics the majority of the time. They're just kind of constantly on them. One thing as well to understand about these bacteria is the good ones are something that you have been developing over a long period of time. So throughout your life, in fact, throughout generations, all of these little helper bacteria have been adapting to your environment, to your culture, to your habits, to your family history in order to help you survive and help you live longer and healthier and a better life. And so, unfortunately, with antibiotics, in one fell swoop, we can really set ourselves back. And it's not just a matter of being able to make up for that in a day or a week or a month or a year or potentially even a lifetime. One of the most dangerous things about antibiotics is they really undo so much history, so much adaptation there. We just really don't understand at this point how to get that back very quickly. So what do we do now? People, they show up and there's a couple scenarios. One, they're getting sick and they're not sure what to do. They feel horrible, and of course they say, okay, what do I do? The other scenario is they say, well, I'm going to go to the doctor, and then they say, I went to the doctor, he put me on antibiotics. So those are kind of the two ways that play out. If you've already been on antibiotics, a couple things that you're just going to have to do to at least kind of mitigate some of that damage. As soon as you're done with the antibiotics, you're definitely going to have to take a high dosage probiotic. That's going to start to repopulate your body with the good, healthy bacteria, and at least kind of plant some seeds there in the open space so you can get some new, good, healthy growth going. I would recommend a number of different high quality and large dosage, high dosage probiotics. Really, we don't want to just kind of stick with one, but you're going to want to get something that's a large spectrum, high dosage probiotic, and you're going to want to not just take kind of a normal dosage for that. You're going to want to start maybe a little light, but end up over kind of heavy on the dosage. So usually, say you get a probiotic that's going to last you a month. If you can ideally get that in you within 10 days to 2 weeks or so, that's a good start to get the good stuff back into your body. And then we'll probably want to kind of switch around to some different probiotics to again cover all our bases and repopulate things. And that's a bare minimum just to kind of regain as much of that lost ground as possible in a hurry. The second thing you want to do is look at your vitamin D in particular. Usually the reason why people are getting sick in the first place is because they're deficient in vitamin D. And we have another video where I go through all the details on that. The third thing you'll absolutely need to do is increase your intake of raw vegetables. That's going to actually be kind of the fertilizer for those good probiotics. So you're going to intake those probiotics, lots of them. You're going to intake lots of raw vegetables to make sure those grow and take root and flourish. And the last thing you're going to do is not screw it up. So one of the big problems is for most people, they'll take an antibiotic, they'll kill all the good stuff, and then it's the bad stuff that grows in its place. So for example, eating a lot of sugar means you're going to get a lot of yeast and whatnot that's going to grow in place of the good stuff. A lack of vegetables. And a lot of people are going to end up with small intestinal bacterial overgrowths, yeast infections, that sort of thing, because they've essentially changed the entire biome or the entire kind of microenvironment inside of their body with these antibiotics clearing the slate and then just all the bad guys moving in. So we have to avoid all that stuff. Now, if you haven't taken an antibiotic yet, I would definitely encourage you to try and avoid it. And fortunately, there are some things that are actually much more effective. One, I would just go through exactly what we were just talking about. So start taking some probiotics, maybe increase your dosage for the next week or few months. Cover a large spectrum at a very high dosage just to make sure that you're supporting your body with all the good guys. Second, make sure your vitamin D levels are where they need to be. Maybe take a bit extra for a short time period. Three, make sure you're eating lots of raw veggies and avoid all the sugar and the processed foods that are going to kind of support the bad guys. Three, things like there's a lot of natural things that are very antibiotic in nature, and also, imagine this, selective. So rather than kind of nature's antibiotic is only going to kill the bad guys and save the good guys, kind of processed man-made antibiotics just kill everything. So the natural antibiotics are going to be things like garlic. So you want to really increase your intake of that. You can even get garlic in capsule form. But I mean, you could be downing whole cloves of garlic to get that antibiotic effect. Things like turmeric, or the active ingredient curcumin, is very antibiotic as well. There's a whole list of them. You can just kind of do a quick Google search for natural antibiotics, and you'll see the foods and herbs and spices and things that have those properties, naturally. So that is really where I would start, and I would just keep in mind that you need to invest in your future when it comes to your health. So a lot of times we just want a quick fix. We just want to feel better as soon as possible, and I get it. I've been sick before, and it's not fun. But understand that when you heal naturally, you get a very different outcome, and your future changes. You heal naturally, and your immune system gets stronger, and your immunity gets better. And so you're less prone to sickness in the future. You're more quick to heal if there is a problem down the road. And you're going to be, again, kind of investing into the future there. Whereas if you just go for a quick fix, especially if it's something like an antibiotic, things may seem good in the here and now. Your problem may seem to go away. But unfortunately, you've really hit the reset button on things. And down the road, you're going to be more susceptible to problems, kind of fighting a losing battle. So you don't want to win the battle and lose the war. Let's invest now and make sure that we're good in the future. That's pretty much it when it comes to antibiotics. So if you have any questions, let us know. We'll either put some links here, or if you want to ask us, usually in clinic we'll have a few options as far as, again, heavy dosage, broad spectrum probiotics, and a couple different ways to mix it up there to make sure that you're good to go. But again, if you've taken an antibiotic recently or on one now, as soon as you get off of that, make sure, again, you got to get on a high dosage probiotic. You need to increase the intake there. Raw vegetables, vitamin D, cut the sugar in the processed and refined foods, and that should handle the problem. And then just give it time and be patient. If you have any other questions or anything, let us know. But look forward to seeing you soon. And that's antibiotics in a nutshell.